My name is Dr. Amer Siddiq Amer Nordin. I'm a consultant psychiatrist and smoking cessation specialist from Malaysia. I currently work in the University of Malaya, in Malaysia, in Kuala Lumpur, and am involved with the Quit Smoking project with the Ministry of Health, where I've helped to develop, train, and also assist people to quit smoking under the ministry. So we've been using the Smokerlyzer, the CO breath testing, for a number of years. We started our group, the Nicotine Addiction Research Group, in 2009 with a research project in training dentists to be part of the quit smoking agenda in Malaysia. And since then, we've been introduced to the carbon monoxide breathalyzer during that period of time. As part of my PhD a number of years, a year or two after we started the group, also I've been introduced to the benefits of the breathalyzer in terms of assisting people to quit smoking. And when I returned back home as part of another research project, we purchased a number of these breathalyzers in order for us to assist, again, people to quit smoking as part of our study. And since we developed the MQuit program, which is a nation-wide quit smoking program in Malaysia, we have insisted that the carbon monoxide breathalyzers used during this particular period, because you really need to know the status of the smokers prior to starting them on any form of treatment, whether it's behavioral or pharmacological. And we found that the carbon monoxide breathalyzers have been extremely useful in this particular work. So it's probably been about almost 13 years now, 14 years of using the breathalyzers, at least in my experience. Well, it's really interesting. Since we've been using it for the last 13 or 14 years now, the technology has changed. I remember using it when it was that small little wee device. And then there was one that you really had to have your gaming agenda on, because you got to press it really quick, right? And now it's evolved into this touchscreen type of method. And I think the most important thing about the Smokerlyzer that I found quite useful, and my whole team finds quite useful when we're doing quit smoking projects, is that it's really easy to use. It's a very objective way of measuring the level of carbon monoxide. We like it, patients like it. We can see it change over a period of time, and I think the support from at least the distributors that we've been working with in Malaysia has been tremendous in making sure that the products that we've got with us give the best quality in terms of the results. And I think more importantly, we're also very thankful that the products have evolved, like I said, from these very very skill-based to now a little bit more easier to use on touchscreens, which we all like. So they're very easy to use, they're reliable, the results are valid, and of course the support that we get from the companies that make it has really been helpful for us. I think if you're going to do quit smoking services for any country, you really need to use all the tools that's available for you. So we're lucky in terms of this particular work that we're doing, that you've got an objective measurement that you can actually use, which is not too inexpensive at all, which allows the individual who is targeted, in this case a smoker, to objectively be able to measure the levels of carbon monoxide in his system. And as he continues or she continues in quitting, a journey to quitting, we can see that number reduce over time. So we find that kind of feedback, or we call it biofeedback, really helpful for patients or clients to actually continue the journey towards quitting. So we found that to be something that we enjoy quite a lot. I think the other thing is that with the tool that we have with us, the carbon monoxide breathalyzer, it's really something that all of us clinicians should have, or those who are in the program should have, as part of their SOP, or standard operating procedure. Just like doctors have their stethoscopes, maybe nurses have their own devices. If you're going to be doing quit smoking programs, one of the tools that you need to have, and we've insisted this as part of our own ministry efforts, the carbon monoxide breathalyzer, because it's the only way that you can measure the changes over time for people who are wanting to quit their smoking addiction. Well, I'm really passionate about helping people to quit smoking for a number of reasons. I think one is that as an individual, I've got family members who smoke, and some of them have struggled with their smoking addiction. And the good thing about one of my mentors, Professor Hussein, he shared with me that experience that we don't have, at least in Malaysia, at that point, a psychiatrist who was specializing or subspecializing in this field. So that was one idea that came to me from him, that I thought, hey, this is something that I could do to help people like my own family to quit. Because as we know that an individual who smokes is dealing with an addiction to nicotine, and as a result of addiction, they continue to smoke and cause many medical complications. I think the second reason why I'm passionate about it is that if you look at all the medical complications that we know of, and we talk about something called medicine 2.0 now, you do an assessment, you find out you've got some illness, and then you treat it. The majority of those medical conditions, the major risk factor is smoking. So I've always believed that if you could prevent individuals from starting smoking, or for those who have made a mistake and they started to smoke for whatever reason, and we know from research it's mainly due to peer pressure, when they didn't know better at that point of time, and now they know and they want to quit, then at least having somebody to help them quit, and it could be one of us, has been really rewarding in order not only to help them, but also to help the population at large in reducing these medical conditions. And I think the third reason is just that I think every medical doctor is almost like morally and ethically obligated to assist somebody who smokes to quit, because it's the major risk factor for non-communicable diseases. And if you could even ask them about their smoking and offer them ways to quit, even by referring somebody to quit smoking services, I think you've done your part. And I think this is the reasons why I'm really passionate about helping people quit smoking.